There must be some reason.
In his address on Saturday evening, President Museveni sounded a warning to the country following a surge in the number of COVID-19 infections. According to Museveni, Wachisa and Kampala are hotspots, and he called for more vigilance in those areas.
So therefore, Ugandans who are in the villages, don't come if you are not doing serious work, if you are not trading.
Now, some health activists have given their views on what they believe might be behind this surge.
People reached a point and they were COVID fatigued. What that meant that even when ministry was saying we register this many number of cases, the public was not minding because they had felt gutted with being confined and being in one place. There was the urge to look for the means of survival. There were more important things to worry about, like food and get income, than to worry about how many cases that were being registered.
Kukundakwe of the Center for Health, Human Rights and Development calls upon government to incorporate issues of health emergencies as one of the lessons learned from the COVID-19 pandemic.
We were gambling a lot with COVID-19. It was a very unprecedented, and it required to take very unprecedented measures. But I think it is important that we draw a lesson from it. COVID is here, tomorrow it will be another health emergency. So it is very important that even as we develop laws, policies and national programming, we actually incorporate the issue of health emergencies and how to adequately respond to them. I am very cognizant of the fact that some of these health emergencies are very unprecedented, they've never happened before, but it is very critical that actually it's better to start from somewhere than starting from nowhere.
For Kukundakwe, a lockdown and closure of schools are unnecessary considering the effects of the first wave of the pandemic.
So with the very many cases arising, I certainly don't think that locking children back home is a solution. COVID is here, we don't know for how long, but already the learners already lost a year while at home, even those ones who have already returned to school. So if the price is so heavy to pay that you'd make a decision to make sure to let 15 million learners stay at home in this period, for a time that is not defined. COVID can be here forever. It can be here as long as HIV has been here. So it's certainly the fact the government instead needs to find ways, innovative ways, and be willing to invest in money to make sure that young people continue to go to school. For example, you're talking about social distancing. When the government was opening schools, they quickly drafted guidelines for reopening of schools. But the situations that they were suggesting in schools, most of them are not ideal, because you're asking a school to create social learning, but they're not building new infrastructure. Neither is government doing that. So it's definitely very important that the government invests in infrastructure, create more rooms to allow the social distancing, ensure that the schools can afford even hand washing facilities, because I know that with the schools reopening, some of them were even struggling to even meet the bare minimum guideline or standard that had been set by government.
According to President Museveni, the National COVID-19 Task Force is set to sit on Wednesday to come out with more guidelines to prevent the further spread of the disease.